Hello guys, my name is Anita Wanga. I'm an exercise physiologist, internist, and geriatrician. In this video, I'm going to talk about topics that are trending in medical news. So there's a website called Medscape that a lot of physicians use to look up different medical conditions, different medications, and different topics in news in medicine, primarily in their specialty. So two of the articles that caught my attention, even though these are not related to my specialty, are one article talking about fake Botox. And the reason it's a concern is because more and more people are getting aesthetic procedures done by physicians and non-physicians, and unfortunately they're being given Botox that is actually not Botox, and as a result they're having complications such as blurry vision, loss of vision, and the list goes on and on and on. And the second article that caught my attention was about individuals that went to a medispa. The medispa was run by non-physicians and they ended up getting HIV. Unfortunately, the platelet-rich plasma or blood that was used in these vampire facials was contaminated or from an individual that had HIV. So that is pretty serious complication. You went to have something that is aesthetic in nature, and as a result you end up with HIV. That's extremely concerning. Or even going to have Botox and as a result ending up with vision problems. That's a very, very, very serious complication. So I'm going to link these two articles below so that you guys can take a closer look at them. So I'm sure the next question you're going to ask is, how can I prevent this from happening to me as an individual if I do decide to go to, say, a medispa? The first thing I would do is look at who is running the medispa, whether they have a physician involved, and whether that physician is actually trained in a field of medicine that might, well, it's not aesthetics, but a field of medicine where during their training they actually learn how to do these procedures and or these injections. The specific medical specialties where they would learn about, say, using lasers to resurface the skin, doing chemical peels, doing Botox injections, and so forth are very few. They actually include dermatology, perhaps plastic surgery, and in some cases oculoplastic surgery. But other fields of medicine, for example, internal medicine, we did not learn anything about any of these procedures. The extent of what we learned about rashes were rashes that can tell us whether somebody has an autoimmune condition like Crohn's or something like that. That's the extent. And then we'd call our dermatology colleagues to help us. So I thought those two topics were very interesting. Again, if you're interested in reading the articles, check the description box below. If you find my videos useful and informative, stay tuned in for more videos. Like my videos, subscribe, and comment if you have any questions. Bye-bye for now.